While the Indian fighting spirit and efforts against COVID-19 have been lauded by the global bodies, the smaller South Asian countries like Nepal and Afghanistan are having a tough time in dealing with the situation. The testing has been significantly lower than the advised WHO numbers, and the hospitals and other medical facilities are running out of essential equipments. Similar situations have developed in Pakistan and Bangladesh, where even the densely populated cities and suburbs have not been able to find the real numbers of patients owing to a poor testing rate.
A rapid rise in the number of COVID patients across Nepal has overwhelmed its state-run hospitals. The weak health system of the country has been exposed as facilities have run out of beds and ventilator, with people running pillar to post for their treatment. The government has imposed a severe lockdown in the Kathmandu Valley. Transportation and gatherings have been banned, with transgressor facing a monetary fine or jail time for flouting restrictions. Earlier, to curb the spread of the virus, the Himalayan nation had enforced a nationwide lockdown in March and had put its 30 million citizens under lockdown for 4 months. However, with the easing of curbs in Kathmandu city, more people came to the capital, which led to a rise in the number of coronavirus cases.
भोलिको दिनमा जुन यो अब यो संक्रमितको संख्या धेरै नै भयो भने जसरी हामीभन्दा धेरै शक्तिशाली र क्षमतावान राष्ट्रहरू पनि आज कोरोनादेखि हार खाइरहनु पर्ने अवस्था आएको छ। उहाँहरूले यस्ता संक्रमित व्यक्तिहरूलाई पनि अस्पतालमा भर्ना गर्न चाहिँ सक्नु भएको छैन। थुप्रै नेपालीहरू पनि अहिले पनि पीसीआर पोजिटिभ भए पनि विदेशमा आफ्नै कोठामा बसेर चाहिँ आराम गरिरहेको अवस्था छ। त उहाँहरूलाई खाली यो उहाँको चाहिँ रोगमा धेरै समस्या पर्यो, अर्थात् उहाँलाई चाहिँ अस्पतालमै भर्ना गर्नुपर्ने भयो, अक्सिजनै दिनुपर्ने भयो, अथवा सास फेर्न गाह्रो नै भयो भने आइसियुमै भर्ना गर्नुपर्ने अवस्थामा मात्रै उहाँहरूलाई चाहिँ भर्ना गरेको अवस्था छ।
These conditions have forced the government of Nepal to ask its citizens to quarantine themselves at home. Seemingly, the authorities were left with no options but to restrict people's movement. Meanwhile, in Afghanistan, a weaker health system hasn't been able to find the real number of patients in the country. Experts say the country, which has reported nearly 1,400 deaths till date, hasn't been able to find the real numbers owing to its weak capacities and over-reliance on foreign aid. In spite of an over 6-month health crisis, the country has managed to perform only a little over 100,000 tests.
د کرونا ارقام نن 488 ټیسټونه په ټول دولتي لابراتوارونو کې شوي دي چې په دې 488 معایناتو کې 48 مثبت واقعي موږ لرو.
Real testing data for country is not available, and humanitarian societies say the number could be much more than what is available in the public domain. Testing numbers in other South Asian countries like Bangladesh too have declined. Dhaka introduced high testing fee in July, which has created more obstruction in finding the real numbers and stemming the spread of the virus. Pakistan, which has suffered huge economic jolts in past few months, has reopened its economy and traffic. Islamabad has allowed all domestic and international flights to resume operations. While it has brought a relief in the Pakistan markets, the government, it seems, has not done enough to contain the spread and in fact has deliberately pushed its people to vulnerability.